Today, I will be showing how to assess the musculoskeletal system, the female and the male genitals and inguinal area, the rectum and the anus, and reflexes. Prior to the assessment of the musculoskeletal system, assemble your equipment, the goniometer. Introduce yourself, verify your client's identity, explain what you're going to do, why it is necessary, and how the client can cooperate. Perform hand hygiene, apply gloves, and observe other appropriate infection control procedures. Provide for client privacy. Inquire if the client has any history with muscle pain, its onset, location, character, associated phenomena, and aggravating and alleviating factors. Any limitations to movement or inability to perform activities of daily living, previous sports injuries, and any loss of function without pain. Inspect the muscles for signs. Compare each muscle on one side of the body to the same muscle on the other side. For any apparent discrepancies, measure the muscles with tape. Inspect the muscles and tendons for contractures. Inspect the muscles for tremors. Inspect any tremors on the hands and arms by having the client hold arms out in front of the body. Palpate muscles at rest to determine muscle tonicity. Palpate the muscles while the client is active and passive for flaccidity, spasticity, and smoothness of movements. Test muscle strength. Compare the right side with the left side. Check the skeleton for normal structure and deformities. Palpate the bones to locate any areas of edema or tenderness. Inspect the joint for swelling. Palpate each joint for tenderness, smoothness of movement, swelling, capitation, and presence of nodules. Assess the joint range of motion. Ask the client to move selected body parts. If available, use a goniometer to measure the angle of the joint in degrees. Document the findings in the client's record. Prior to the assessment of the female genitals and inguinal area, assemble your equipment, your clean gloves, drapes, and supplemental lighting if needed. Introduce yourself, verify your client's identity, explain what you're going to do, why it is necessary, and how the client can cooperate. Perform hand hygiene, apply gloves, and observe appropriate infection control procedures. Provide for client privacy. Request for another woman, if desired, required by agency policy or requested by the client. Determine the client's history of the following: age of onset of menstruation, last menstrual period, regulatory of cycles, duration, amount of daily flow, and whether menstruation is painful. Incidence of pain during intercourse, vaginal discharge, number of pregnancies, number of live births, labor or delivery complications, urgency and frequency of urination at night, blood in urine, and painful urination. Cover the pelvic area with a drape at all times when actually not being examined. Position the client in supine, with feet elevated on the stirrups to an examination table. Alternately, assess the client in dorsal recumbent position with knees flexed and thighs externally rotated. Inspect the distribution, amount, and characteristic of pubic hair. Inspect the skin of the pubic area for parasites, inflammation, swelling, and lesions. To assess the pubic skin adequately, separate the labia minora and the labia majora. Inspect the clitoris, urethral orifice, vaginal orifice when separating the labia minora. Palpate the inguinal lymph nodes. Document the findings in the client record. Prior to the assessment of the male genitals and inguinal area, assemble your equipment, your clinics. Introduce yourself, verify the client's identity, explain what you're going to do, why it is necessary, and how the client can cooperate. Perform hand hygiene, apply gloves, and observe other appropriate infection control procedures. Provide for client privacy. Request the presence of another person if desired, required by agency policy or requested by the client. Inquire if the client has any history with the following: menstrual voiding patterns and any changes in bladder control, urinary incontinence, frequency or urgency, abdominal pain, symptoms of sexually transmitted disease, swelling that could indicate the presence of hernia, family history of nephritis, malignancy of the prostate, and malignancy of the kidney. Cover the pelvic area with the sheet or drape at all times when actually not being examined. Inspect the distribution, amount, and characteristic of the pubic hair. Inspect the penile shaft and glans penis for lesions, nodules, swellings, and inflammations. Inspect the urethral meatus for swelling, inflammation, and discharges. Compress or ask the client to compress the glands slightly to open the urethral meatus to inspect it for discharges. If the client has any reported discharge, inspect the gland, strip the penis from the base to the urethra. Palpate the penis for tenderness, thickening, and pimples. Use your thumb and first 2 fingers. Inspect the scrotum for appearance, general size, and symmetry to facilitate inspection of the scrotum during a physical examination. Ask the client to hold the penis out of the way. Inspect all skin surfaces by spreading the irrigated surface skin and lifting the scrotum to observe the posterior surfaces. Palpate the scrotum to assess the status of the underlying testes, epididymis, and spermaticum. Palpate the testes and uterus here for comparative purposes. Inspect both inguinal areas for bulges or the client is standing. First, have the client with the test. Next, have the client hold his breath and straight the bell down as though having a bowel movement. Palpate fullness and then document findings in the client record. Prior to the assessment of the rectum and the anus, assemble your equipment, your clean gloves, and your water-soluble lubricant. Introduce yourself, verify the client's identity, explain what you're going to do, why it's necessary, and how the client will cooperate. Because digital examinations can cause apprehension and embarrassment in the client, it is important to help the client relax by encouraging the client to take deep breaths and informing the client about potential sensations such as feelings of defecation or passing gas. Perform hand hygiene, apply gloves, and observe other appropriate infection control procedures. Provide for client privacy. Drape the client appropriately to prevent the exposure of body parts. Inquire if the client has had any history with the following: bright blood in stools, starry black stools, diarrhea, constipation, abdominal pain, excessive gas, hemorrhoids, or rectal pain, family history of colorectal cancer, when last stool specimen for occult blood was performed, and the results. For males, if not obtained during the genitourinary examination, any signs and symptoms of prostate enlargements. Position the client. In adult, a left lateral or Sims position with the upper leg acutely flexed is required for the examination. For females, a dorsal recumbent position with the hips externally rotated and knees flexed for a lithotomy position may be used. For males, a standing position while the client bends over the examining table may also be used. Inspect the anus and surrounding tissue for color, integrity, and skin lesions. And then ask the client to bear down as though defecating. Bearing down creates slight pressure on the skin that may accentuate rectal fissures, rectal prolapse, polyps, or internal hemorrhoids. Describe the location of all abnormal findings in terms of a clock with the 12 o'clock position toward the pubic symphysis. Palpate the rectum for anal sphincter, tonicity, nodules, masses, and tenderness. Lubricate your glove index finger and instruct the client to bear down as though having a bowel movement. Slowly insert your finger into the anus and into the rectum in the direction of the umbilicus. The anal canal is short. The posterior wall of the rectum follow the curve of the coccyx and sacrum. The nurse's finger is usually able to palpate a distance of 6 to 10 centimeters. Never force digital insertion. If lesions are painful or bleeding occurs, discontinue the examination. Ask the client to tighten the sphincter around your finger and note the tone of the anal sphincter. Rotate the pad of the index finger along the anal and rectal walls, feeling for nodules, masses, and tenderness. Note the location of abnormalities of the rectum. On withdrawing the finger from the rectum and anus, observe it for feces. If ordered, perform a test for occult blood on the stool. Document the findings in the client's record.